I know we can and we have to do better on these matters. Discrimination of any type isn't acceptable in our organization. But I also know that even despite the decision, the entire leadership group is fully committed to the goal of ensuring our patients, families, staff, physicians, volunteers, students feel that they're valued and respected. That's a message that I think I've been trying to deliver really strongly ever since I came.
We know that at any time we may have to ramp down our scheduled care, and that would happen across our region, and lots of conversation about how we would identify the time that we would actually enact that again, and we have done that periodically over the last few weeks.
Outbreak-related cases are dropping off, but are getting replaced on an ongoing basis through new admissions from the community as well. And in terms of ICU needs, as far as I know, the highest ever that we have had within the city at this point of time, as shown with that black bar at the bottom, now sitting at more than 20 ICU patients with COVID. The UK on the next slide is another great example. They are sitting at roughly 50% vaccinated. They now start with larger numbers of second vaccines. So they basically use the similar approach that we use in Canada, with getting as many first doses in as possible. And again, there's an overlap here with lockdown measures for sure, but they are certainly where we would like to be.
Containing outbreaks is always a multifaceted approach. Early detection is key, again, to try and maintain a reduction in transmission.
Our inpatients who are eligible by virtue of age, but of course are in hospital, some of whom are in long stay. Next week, we will be doing the second round of large-scale vaccination of inpatients across HHS who are eligible on the basis of age.
As of Tuesday, as people return from Easter weekend, we are moving to mandated eye protection for all staff, physicians, learners who are in forward-facing patient clinical settings.
Kind of proceeding with that. And I would say education is really the way to address this, trying to find out what each person's concern is and then addressing them, and not equating vaccine hesitancy to being anti-vaccination.
As both Sharon and I alluded to earlier in the call, I think one last big push over the coming weeks, and I hope with the warmer weather and with the vaccine, we can start to see that curve bend down for the last time.